Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over a specific infection. So it's called C. diff. So it is a very common infection, and that's why I thought I would make a video on it. So we will get into that, but first, if you could hit that subscribe button, it would be greatly appreciated, as it truly does help my channel. So let's get started. So what is C. diff? Okay, so it is an infection of the large intestine. So some people do have this bacterium just in their intestines, and it never causes any signs and symptoms, but they can spread it. Now, some people do have it in there, and all of a sudden it starts flourishing when they're on an antibiotic, okay? So symptoms can range from diarrhea to a life-threatening damage of the colon. So the bacterium is often referred to as C. diff or C. difficile. So the illness from C. difficile typically occurs after or during the use of taking an antibiotic, okay? So what happens is antibiotics, yes, they're killing the bad bacteria, but they're also killing good bacteria, okay? So it's most common in older adults, in hospitals and long-term care facilities, but it can also be in the general population, okay? And it does affect the younger people also. So symptoms. So some people have C. diff and they never actually become sick. So these individuals are carriers of the bacteria and may spread the infections, okay? So signs and symptoms usually appear within 5 to 10 days after starting antibiotics, but it can start the first day and up to 3 months after being on an antibiotic. Now, there is mild to moderate infections and more severe. So we'll talk about the mild to moderate infections first. So this is watery diarrhea. And now diarrhea, C. diff diarrhea, it has a very pungent smell. So if you smelled it before, you will know it. And it's not like any other smell you've ever smelled before. It's pungent, and it's normally orange in color, like orangey color. There is like an orange tinge to the diarrhea, okay? So it may be 3 or more times in one day that you're going to the bathroom. You may have mild to moderate abdominal cramps and tenderness, okay? Now, more severe infections, they tend to become dehydrated, and sometimes they have to be hospitalized because of the dehydration, because they're going to the bathroom, watery diarrhea 10 to 15 times per day. That is a lot, okay? You're losing so much fluid. So it is so imperative that people with C. diff, or people who are having diarrhea in general, are replenishing their fluid, okay? Because they need that fluid. They will experience abdominal cramping and pain. It might be severe, rapid heart rate, dehydration, fever, nausea, an increased white blood count, okay? So your white blood count is going to increase because you have an infection, okay? The bacteria is taken over in your large bowel. It can lead to kidney failure, appetite loss, swollen abdomen, weight loss, blood or pus in stool, okay? When your intestines become inflamed, they can have sores in them, okay? So you can have blood and pus. C. diff infections that are severe and sudden, it is uncommon, but it can lead to an enlarged colon, okay? So it's called a toxic megacolon and sepsis, okay? Sepsis is a life-threatening condition that occurs when the body's response to infection damages its own tissue, okay? They do have to be admitted into an intensive care unit for these severe cases. So when do we see our doctor? So if you're starting to have loose bowels after starting an antibiotic, you want to talk to your doctor, okay? If you're having 3 or more loose watery stools per day, symptoms lasting more than 2 days, if you have a fever, severe abdominal pain, blood in your stool, any of the symptoms that we just discussed, you want to talk it over with your doctor, okay? Because they might want to just switch your antibiotics. So what causes C. diff? So C. diff bacteria, it enters through the mouth and it begins reproducing in the small intestines. Once it does reach the large intestines, that's when it starts releasing toxin damaging or tissue damaging toxins. Okay, so these toxins destroy cells. They produce patches of inflammatory cells, which ends up causing the watery diarrhea. So when the bacteria are outside of the colon, so virtually anywhere in the environment, they are in a dormant state. So they can essentially shut themselves down and still survive. Okay, so this allows them to survive for a really long time in a number of places. So human or animal feces, surfaces in a room, unwashed hands, soil, water, food, including meat. Okay, so once the bacteria finds its way into a person's digestive system, that's when they wake up. Okay, that's when they wake up and start producing infection again. So the ability of dormant C. diff to survive outside of the body enables such easy transmission, okay, of the bacterium, because it can just stay there and lie dormant. So really, washing our hands is just so very important. If we don't have a way of it going into our digestive system, so for stopping that transmission, okay, then it will reduce any bacteria and viruses from entering our body. So risk factors. So although some people have had no known risk factors, still get C. diff, but there are certain times where it increases the risk of having C. diff, such as taking antibiotics or other medications like we discussed. So there are certain antibiotics that put you more at risk. So clindamycin, cephalosporins, and penicillin, okay, those antibiotics. Also, proton pump inhibitors. So to reduce stomach acid, they can increase your risk of C. diff infection. Okay. Staying in a healthcare facility. Okay. So there's lots of people on antibiotics in healthcare facilities. Okay. The older population in nursing homes, there is lots of antibiotics. Okay. So they're at higher risk of getting a C. diff infection. And then this puts everybody at risk, okay? Because it can spread so easily and it can lie dormant for so long. So it can spread on hands, cart handles, bed rails, bedside tables, toilets, sinks, stethoscopes, thermometers, telephones, remote controls. So when we're in a facility, we got to be really careful at what we're touching and making sure everything is cleaned very well, especially in between patients. Okay. Having a serious illness or medical procedure. So inflammatory bowel disease, weakened immune system, chronic kidney disease, gastrointestinal procedures, and other abdominal surgeries put you at higher risk. Okay. And older age. Okay. Age is a factor for C. diff. So what are some of the complications of C. diff? So like I discussed earlier, dehydration. So anytime you have severe diarrhea, you are at risk for dehydration. So just replacing the fluids that you are losing. This can also drop your blood pressure, okay? Our blood pressure is controlled by the amount of fluid in our body, so it can drop to dangerously low levels, okay? Kidney failure. In some cases, dehydration can occur so quickly that kidney function rapidly deteriorates. Okay, it can lead to kidney failure. Next we have toxic megacolon. So this is a rare condition where your body is unable to expel the gas and stool, and it causes your intestines to enlarge. So it's called megacolon. And if left untreated, it can rupture, okay? And this leads us to our next point here. If it ruptures, it creates a hole in our large intestine, okay? This is once again a rare condition, but the bacteria from your bowels spill into your abdominal cavity. This is a life-threatening complication, okay? And then death. So rare, it's very rare, but mild to moderate C. diff infections. But in more serious infections, death can happen, okay? It can progress very quickly if not treated properly. So prevention. So really in healthcare facilities, it's super, super important to follow strict infection control guidelines, okay? So we're going to avoid unnecessary antibiotics. So if there is a way, especially with wound care, okay, this is, I like to talk about this a lot because sometimes antibiotics are used unnecessarily in wound care. So that's why I always preach, use your nerds and stonies, making sure that it's not just a local infection. Because if it's a local infection, we can treat it topically, okay? So antibiotics, they can be great, but once again, they can cause complications. So we don't want to be using them unnecessarily. Hand washing, okay, contact precautions. So if we have somebody in a healthcare facility, we want to have them on healthcare precautions, okay? So that we're wearing gloves, gown, just making sure that the person is in a room either isolated or with someone who also has C. diff, okay? Thorough cleansing. So because this infection, it can survive for such a long time outside of the body, we want to make sure that we're cleaning with chlorine bleach, okay? Because that is what kills this, okay? Chlorine bleach is what kills C. diff. So diagnosing C. diff, so it's normally based on the presence of diarrhea, other signs and symptoms of C. diff infection, and they'll take a stool sample, so there's presence of C. diff. Now, the diagnosis of C. diff, it is kind of based on symptoms because, like I said before, some people do have C. diff in their bowels without symptoms, okay? So it just kind of lies dormant. We're treating based off symptoms, okay? So we take a stool sample. They'll probably order one or more for laboratory testing. There could be a colon examination with a little camera. And then if you are having complications, they'll probably do like a CT scan or x-ray of the colon, just to see if there's thickening of the walls, enlargement of the bowels, or for any holes. So if the doctor does think that there's any complications, they will order imaging tests. So treatment. So once again, we're only treating people who have signs and symptoms of infection. And it's kind of funny because antibiotics is what normally causes this. I mean, it can be spread person to person, but normally brought on by antibiotics, and you have to treat it with antibiotics. So certain antibiotics is what treats it: vancomycin, fidaxomicin, and Flagyl, with combination of vancomycin for very serious infections, okay? Now, sometimes surgery is needed, okay? If sometimes the colon parts of the colon may die. So, or if we have severe pain, organ failure, toxic megacolon, inflammation of the lining of the abdominal wall, if there's parts of the colon that die off or not working properly, sometimes they do need to be removed. So treatment and reoccurring infection. So approximately 25% of people treated for C. diff get an infection again. Okay. So a lot of times they will switch the antibiotic that you were currently taking because it was causing C. diff. It was causing it to flourish. But then all of a sudden you're getting sick again because you went on to other antibiotics to treat the C. diff and it's not treating the other infection. So it's kind of a catch-22. So if you're older than 65, you're at high risk for reoccurrence. If you're taking any other antibiotics, have any severe underlying medical conditions such as kidney failure, inflammatory bowel disease, chronic liver disease, you're at high risk of reoccurrent infections. So treatments, so there's antibiotics. So antibiotic therapy for reoccurrent infection may involve one or more courses of medication. They have antibody-based therapy. So this is human antibody that actually have been has been shown to help reduce the risk of reoccurrence. Okay, there's fecal transplant. Okay, so there's a donor here, and their fecal matter is gone through all the testing, make sure that they don't have any parasites, bacteria, whatnot, but it's actually put through in a tube, and it's a fecal transplant. So you get the good bacteria throughout your body. And then probiotics. So probiotics and antibiotics, I personally believe that they go together 100%. Okay. It hasn't been proven to be helpful. Okay. There's not a whole lot of research that has been done on this. They're currently doing research on this. But it's controversial still. And because the testing, it hasn't been there. Okay. But if you think about it, probiotics and prebiotics, they're giving you the good bacteria in your gut. If you have a good, healthy gut, the chances of C. diff being able to take over are lessened, in my opinion. Okay. So personally, as a wound care specialist, anytime any of my patients had to go on an antibiotic, and some would have to be on IV antibiotics, I would always tell them, like, this is hard on your system. We want a healthy gut. Okay. We want to make sure that we keep that healthy gut going. So take a probiotic. Okay. Really, it's good. It's good for your intestinal health anyways. It really can't do you any harm. So why not, right? So what can you do at home? So this is really supportive treatment for diarrhea. So plenty of fluids, making sure that they contain salt, sugar, diluted fruit juices, soft drinks, broths, because you are losing so much more than just water. You're losing nutrients through your diarrhea. Okay, so you want to make sure that you're replacing your nutrients, your electrolytes. Okay. Good nutrition. So if you do have watery diarrhea, you do want to stick to starchy foods, potatoes, noodles, rice, toast, crackers, bananas, soups, boiled vegetables, broth. That's your line of defense. Applesauce. Okay, those are all great for diarrhea. And you kind of want to stay away from the milk-based products because it might be really difficult for your body to digest those for quite some time after diarrhea. Okay, so just stick to your more basic foods, your starchy foods. So I hope this video did give you a better understanding of C. diff and how we treat it and the complications. But that's all I have for this video, guys. I hope to see you in my next one. Bye for now.